This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
The word cancer has the ability to induce fear in a person like nothing else. Anxiety, depression, sadness, they too usually come with a cancer diagnosis. It can sometimes be hard to have hope. That's especially true with certain types of cancer. Consider pancreatic cancer. The American Cancer Society reports pancreatic cancer is the fourth leading cause of cancer deaths behind lung, colon, and breast cancer. But pancreatic cancer is expected to become second deadliest by the year 2020. The 5-year survival rate is just 6%, and more than 70% of pancreatic cancer patients will die within the first year of diagnosis. Well, despite the grim numbers, there are people who can beat the odds, and our next guest is proof. Chris Gibson of Delmar has been battling pancreatic cancer for more than a year and a half now. His wife Sherry also joins us, along with Dr. John Mansuetti, radiation oncologist at Peninsula Regional Medical Center. Thank you, everyone, for joining us. Now, Chris, I want to start with you. Take us back. How did you know there was a problem to begin with?
The biggest issue I had was back pain. It was hard for me to stand up, and it was just a challenge to move around and stand straight up was the biggest issue that I had. And weight loss, I started losing weight, and just kind of irritable too. I was, I just could feel something wasn't right.
So you knew something was wrong, and
Right.
you went to the doctor?
Went to the doctor quite a few times, and I think it was like 13 trips I made to different doctors trying to figure out what was going on. Pancreatic cancer is really hard to pinpoint exactly that's what it is.
Right.
There's so much other stuff that gets
They thought it was something else?
yeah. You get diagnosed with one thing, and then they check that out, and it's not, so we went through all that.
And you say you lost weight. You lost quite a bit of weight, is that right?
Yeah, I lost over 100 pounds.
Wow.
But I've gained 22 pounds back, so I'm starting to somewhat look like myself again. But
So you finally got the diagnosis of cancer after how many doctor's visits?
13.
13?
At least 13 there at the end before
Yeah.
I was diagnosed.
What was it like to hear that?
Surprisingly enough, kind of relief that I had found out that there was another step to go from, because before it was nothing. Nothing, nobody was telling me anything. And then a day or so later, sorrow set in, and reality that most people don't come back from this kind of stuff. So.
And was it your grandfather who had cancer?
Yes, yeah. Cancer runs in my father's side of the family.
All right, Sherry, as a wife, how's it been for you? It can't be easy.
No, it's hard. It's really hard. To watch somebody that you love suffer, to be in pain, it's very difficult, and to know that there's something wrong, and there's, trying to figure out the whole process of this, trying to find out what was going on with him, and finally getting the diagnosis, and then doing the research and seeing the numbers are so grim, and there's so little hope. So it was life-changing, forever life-changing.
And you have a son.
We do. Yeah, we have an 18-year-old,
And
Tyler. Yes, he
there
just
he is.
graduated. Yes.
Obviously hard on him.
Yes, but he's a tough kid. He's kind of our saving grace. He keeps us, keeps reminding us that life does go on,
Right.
and you have to keep pushing through and keep fighting.
And pancreatic cancer, your pancreatic cancer is inoperable, but you're still doing well, right?
Right. I try not to let it hold me back. Of course, there's a lot of things I can't do that I used to be able to do and would still love to do. But, I got to pick and choose. Now we look at things in a different aspect of, well, we'll do this now instead of doing what we were going to do before, physically. That's my biggest thing. I'm so tired now, more so than what I used to be. Now, like, I just had chemo last week, and like I have issues with fever now. Like I have fever, not every night, but I get fevers quite a bit.
So you're
now,
not in remission.
No, I'm not in remission.
What's the prognosis at this point?
Well, I don't know. My prognosis is I'm doing what I can, but she probably knows a little bit more so about that.
We're hoping to get, 5 years, to extend his life by 5 years, and that's kind of our goal. Is just, we've made it 18 months this fall, so far, and he's been doing really great and really pushing through the really difficult times. So that's kind of our hope. Each and every day is a blessing. We try to, each day is just, it's one day at a time. It truly is. Just trying to get through every day, and then you go to bed, and each morning is a blessing. So.
Yeah. Well, they only gave me 3 months to live when I was diagnosed, and that was 19 months ago. So, every day when you wake up and hit your shoes hit the floor, it's like let's try to figure out to do something.
Right. Dr. Mansuetti, obviously their story is one of many.
It's pretty amazing.
Yeah. Why is this cancer so deadly?
Well, one of the big problems is the location of the pancreas. It's deep into the abdomen, and often it's very advanced when it finally gets diagnosed. The signs and symptoms are very nonspecific, so the symptoms that you had are not uncommon to have. The diagram on the screen there shows that the pancreas is very close to the stomach, the duodenum, which is the first part of the small bowel that goes around it, and its function is to help with digestion, and so there's a lot of blood vessels that you can't see on that image that surround the pancreas, and oftentimes patients have the cancer that surrounds those blood vessels, and they can't typically be resected. So at that point, surgery is out of the question for a patient with advanced pancreatic cancer.
So there are symptoms, they're often late, but what are they?
So oftentimes a patient will have weight loss, which is what Chris had. They will have a abdominal pain that sort of radiates through the back, and I think you said something very similar to that. They have fatigue and just this feeling of not feeling well. Another common presenting symptom is painless jaundice. That's where their patient's skin actually starts to turn yellow for no reason, and we know something's bad when that happens.
So who's most at risk for pancreatic cancer?
So typically it's patients, we rarely see a young patient like Chris. Most patients in their 50s, 60s, and 70s. There are some risk factors. The ones you can modify or smoking history, obesity is a risk factor, as well as significant alcohol use. And family history plays in it also. Certain people have a genetic predisposition for pancreatic cancer.
Now, there isn't a screening for this. Why is that?
No, there's not a good screening test for pancreatic cancer. The CT scan is a test we would typically use to diagnose this, but we can't do CT scans on everybody in the high-risk group, and so basically there is not a good screening tool to try to tease out who has pancreatic cancer and don't. Without typically you have to wait till a patient shows up with symptoms, and oftentimes the story of a patient coming in multiple times before they finally get the diagnosis is extremely common.
Right. Sherry, Chris, if there's one message that you would like to send out to those who have just heard your story, what is it?
Embrace life.
Yeah.
Embrace life, because you never know.
Keep your eyes open, and just keep moving forward. Don't take your life with your family for granted. That's who you have. Yeah. They're our biggest supporters, our family and friends. And actually, I don't even really want to call them friends anymore. They're my family now. Yeah. That's the biggest thing. They've helped me keep a positive outlook, and my wife as well.
They never give up hope.
Never give up hope. Yeah. Thank you so much, Chris and Sherry and Dr. Mansuetti.
Thank
you. And of course, to read more from PRMC about pancreatic cancer, including information on support groups, go to delmarvalife.com and click on the show tab. And while we're talking about pancreatic cancer, you may remember seeing the 60 Minutes report of a teenager being recognized for his work to possibly detect pancreatic cancer after the death of a family friend. That teen, Jack Andreka, is from right here in Maryland, in Anne Arundel County. He's now talking with 2 biotech firms to manufacture the test. He was also recently honored by the Vatican for his work. Jack says it was amazing to be recognized by the Vatican because he's a gay scientist. He says it shows how much the world has grown to accept gay people. Well, any type of cancer is tough to face, but one woman on Delmarva is trying to help boost morale for women battling breast cancer. Up next, we learn how she's giving women the confidence they need to keep up their fight. And later, it's often hard to keep up with cleaning the house, from the bathrooms to the bedrooms and everything in between. We're going to show you one way to go that will leave you more time to spend with the loved ones you love. Speaking of the ones you love, maybe you have no clue what to get them for Christmas this year. How about a gift card that won't cost you a penny? A little later, we'll tell you how to win. Delmarva Life, we'll be right back.